TMJ, here's 2 ways to reduce your TMJ pain instantly. This is a Q&A, so this is the answer. 2 ways. Number one is you want to massage all around the joint. TMJ is the joint, your joint right here that actually hurts. It hurts when you talk, hurts when you chew, hurts when you move your mouth. So you want to massage all the muscles all around the joint and to relax the joint. Second way, you want to use your hands, okay? Use your hands. So in this area, see this corresponds to the joint. You want to massage into the joint. You see these knuckles? You want to massage into the joint. Press hard, it's going to hurt. As you're pressing, move your mouth, move your joint, okay? Massage, ow! Move your joint, right? You want to move that joint and you want to find the joint that hurts the most and massage that.
Hi, I'm Julie, and I came in here for TMJ pain and headaches, and acupuncture is helping me a lot. It's gotten the pain down, so I'm not having to take prescription pain pills, and I would recommend my friends and family to come to Dr. Yin.
Hey guys, Jimmy Yin here, the acupuncture guy with Achieve Integrative Health. And today's Thursday, we're going to talk about treatment. So Tuesdays and Thursdays, we talk about treatment Thursdays. And so I'm going to continue on the list of disorders that Lucy wanted me to talk about. And so we're going to basically talk about facial paralysis, right? So if your face is frozen, right? There's so many different reasons why your face is frozen, and a lot of times people don't know, doctors don't know, dentists don't know why your face got frozen in the first place. So here's some common things about facial paralysis. Facial paralysis, and the most common one that we know of, that we hear, let me move this back a little, that we hear, we see quite a bit of is Bell's palsy, right? Bell's palsy is just facial paralysis of one side of the face where it's just drooping, they can't smile, they can't close their eyes, they can't raise their eyebrows, it's hard to eat. When they drink, when water kind of just comes out, it's hard to seal the lips. And so we commonly see that with Bell's palsy. And we also see it with like dental procedures, like when someone goes and gets a root canal, or somehow the dentist affects the nerve and it causes paralysis, right, the next day. We also see it with people who have neck issues. Any type of neck issues, the nerves come around, they wrap around, and they can go into your face and they therefore cause facial paralysis, right? And anything that will affect the trigeminal nerve. And we see that commonly with dental issues. Dental issues because there's 2 branches of the trigeminal nerve. The trigeminal nerve is basically means 3. So you have 3 main nerves that go into your face, the 3 main branches. And so one goes across here, one goes down here. So one goes across here to the upper gums, upper teeth, one goes down here to the lower jaw, and one goes to your forehead, right? That's why when people who have facial paralysis, they lose that function, going like this, they can't do this, right? And they can't close their eyes, and they can't smile. And so some of those dental procedures, they may nick the nerve, the trigeminal nerve that goes here, like you're doing a root canal, and it affects the trigeminal nerve, and it goes backwards, and affects this nerve, which affects the other 2 nerves, and it causes facial paralysis, right? And so one of Lucy's questions is, if they had surgery or if they nicked the nerve. Well, if you cut the nerve, especially like the trigeminal nerve, it's not going to grow back, right? Any large fiber nerves that when you sever them, when you cut them, you damage them, they're not going to regrow. Now the small fiber nerves, so we have the 3 main branches, right? Let's say we have the 3 main branches of nerves, the trigeminal nerve, one goes up, here. Now we also have these little fiber nerves, little small fiber nerves that come from those, right? They're like these little nerves, like little vines, right? These nerves actually can regenerate, right? But if you nicked one of these big, large ones, the chances of that regenerating is almost to 0. And to really help someone restore that function, it becomes very, very minimal, okay? I don't like to say anything's impossible because miracles happen every single day, but the chance, if you nick one of these large nerves, the chance of it regrowing is probably not gonna happen, okay? So if you have any type of facial paralysis, what causes them? A lot of times people don't know. Like when it's a dental procedure or if you have a trauma to your neck, then we know the cause. But a lot of times people come to us and there's no cause. And they suspect it's some type of virus infection. It's some type of virus infection like the flu, COVID, or bacteria infection, or some type of infection that inflames the nerves and it basically affects the nerve function, right? So any of these things can cause facial paralysis. What do you do? So what do you do? One of the things is you got to understand how nerves regrow, and that's one of our specialties. So we specialize in neurology at Achieve Integrative Health, and so we're very good at it. And how do you get nerves to regrow? Well, I like to use the analogy of how do you, if you have kids, right? You have a baby. How do you get your baby to grow? Your baby needs to do 3 things, right? It needs to eat, it needs to sleep, and it needs to poop, right? So your nerves need the exact same thing. It needs to eat, sleep, and poop, right? So how do you get your nerves to eat, sleep, and poop? Well, where are all your nutrition carried in your body? Through your blood, right? So everything you put in your mouth, it eventually goes into your bloodstream, and then it gets distributed to all the different cells in your body, including your nerve cells, right? So by improving blood circulation to the nerves in your face, you can allow your nerves to eat, right? So how do we poop? Poop is the same thing. How is poop transported from our face to our intestines, to our kidneys, where we pee it out, poop it out, and maybe sweat it out, right? It's also carried in your blood. So just by moving blood circulation to the nerves, right, to your nerve cells, to these nerves right here, we can provide nutrition and we can eliminate poop. So how does it sleep? Well, your nerves sleep when you sleep. So sleep is vitally important. Sleep is a time where your body starts to regenerate itself. It goes to something called autophagy, right? It's called self-correction. So we have this built-in autophagy. We have this built-in mechanism called autophagy, and it is triggered, okay, when we sleep and also when we're like a little hungry, okay? It's the time between our meals, right? It's during these times that it triggers autophagy, which means self-correction. Our cells start to, we have a phenomenal program in our body, and our cells can start reprogramming itself. It can correct the incorrect programs that's been happening during autophagy. So that's when you're sleeping, when you're resting. That's when your nerves sleep also, right? So if we can get those 3 things to happen: eat, sleep, and poop for your nerves will regenerate. Okay. Now it does take time. Our nerves regenerate at 1 millimeter per day, and we have trillions of nerves everywhere in our body, right? So it does take time. So you got to be patient. But if you can provide the right environment for the nerves, eat, sleep, and poop, your nerves will regenerate and you'll start to slowly reverse that facial paralysis. All right, guys? I won't go into too much detail about all the tools, but acupuncture is definitely one of the best tools to help regenerate your nerves. If you do have any questions, comment below or give us a call. This is Jimmy Yen from Achieve Integrative Health, and remember, as always, everything in life is achievable.